My name is Natalie Tedrick, and this is my Case Connections Unit 2 video. Here is the date. It is August 24th, 2020. So for this Case Connections Unit 2, I decided to look at case number 3 and 4. So case number 3 is the patient presenting with polyuria and polydipsia with lab work showing decreased insulin levels. So this suggests that the patient is hyperglycemic, meaning his blood glucose levels are high, and the polyuria polydipsia would be due to the increased glucose levels in his blood. When you have increased glucose levels in your blood, it changes the osmolarity of your blood, which causes you to drink and urinate more because it pulls water into it. I believe that his fasted blood glucose level would be above the normal range because his insulin levels are low. Since he has such low insulin levels, his tissues are unable to obtain energy from blood glucose. So this means that the enzymes present in his body would be glucagon and lipase, because if his tissues aren't able to absorb glucose as an energy mechanism, they need something else, and so that would be fats. So the glucagon and the lipase help with breaking down fats to use them as energy. We know that this is not sustainable, or as sustainable as glucose is. So that would be kind of where we would go with that case. Looking at case number 4. So that one is a previously healthy 2-month-old baby presents with jittery spells after breastfeeding. She hasn't had anything other than breast milk since birth. The baby is only recently started sleeping more than 2 hours between feedings, and that's when this started. So her blood work shows hypoglycemia, but other than that, there's really no abnormalities. Epinephrine is administered, and there's no increase in blood glucose, but there's an increase in blood lactate. And then on her physical exam, it shows a liver edge 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms hepatomegaly, or enlarged liver. Her blood glucose levels increase after breastfeeding, but she can't maintain blood glucose levels within a normal range during fasting. Based on the information above, what symptom or what is the most likely diagnosis? And so we go through a couple different things. There's the main key points are the enlarged liver, the hypoglycemia, and that her blood glucose levels do increase after she's breastfed. So there's no inability to uptake glucose because her levels after she's fed, they increase and everything's quote unquote fine there. But then within a normal range where our body should still be able to maintain glucose levels, hers drop. So choice A is hereditary fructose intolerance. If that was the issue, she would get hypoglycemic after injection of fructose, which is not the case because she's only breastfed. So that one's pretty much irrelevant right off the bat. Choice B is galactosemic. So if that was the case, her blood galactose level would rise due to not being able to process galactose. And we're not really seeing that because what we're seeing on lab work is hypoglycemia. And then the big one, glucose 6-phosphate dehydrogenase deficiency. So that would cause her to be hyperglycemic. That would create more glucose in her blood. And so none of those fit her symptoms, obviously. Because I think the biggest explanation of this being choice C, glycogen storage disease, is the fact that her blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range. And also, this is recent for her to sleep more than 2 hours between feedings. So she's sleeping, she's not feeding, she's not crying for a bottle, she's sleeping, and then she, presents jittery, etc. So with her glycogen storage disease, that occurs in the liver, and her physical exam shows liver abnormalities. Glycogen is what is stored to keep our blood glucose levels stable after a meal. Homeostasis of blood glucose levels after a meal. Since her liver is abnormal on physical exam and she's able to get her blood glucose levels up, but she's not able to maintain them, that points to glycogen storage disease. Also, again, like I mentioned earlier, this recent finding of sleeping longer periods and not eating for longer periods also point to that, because this isn't something that occurs quickly or that was noticed earlier. It occurs over time, and you need to be able, the whole point of this occurring over a period of time is what indicates the glycogen storage disease, because it clearly shows that she is not able to keep blood glucose levels stable. And again, we know that glycogen is stored to help maintain blood glucose levels in between feedings, and that is stored in the liver mainly. So those are our 2 cases, and this was also very beneficial in reviewing for Unit 2. Thank you.